Hello everyone. Today I will be presenting on my topic integrating discharge protocol to improve patient satisfaction in the acute care setting. My name is George Mafwil, and this is part of the requirement to fulfill the Doctor of Nurse Practitioner program at Maryville University. I will begin by thanking the committee member, which comprises of the chairperson, Dr. Kane, Dr. Wanda Lake, and the remaining committee members that have really taken their time to make this project a successful one. Background and significance. Discharge planning is a crucial aspect of any hospital setting. As patients are being admitted into the hospital, they are expected to go home at a certain stage of their stay in the hospital. This has become an important part of my project because I looked at the discharge process in an acute care setting. The aim of the study or the significance of the study is to try to create a change in practice where we'll understand the need for the crucial aspect of discharge process. If a discharge process is not done properly, there will be poor discharge outcome from it. And we know that poor discharge planning can result in prolonged discharge process in the hospital, which in a long way promote longer period of time before the patient leaves the hospital when the discharge order is put into the computer. This long process also increases lower rate of patient satisfaction. It, also brings about implications after a discharge has been done. If informations are not passed effectively to the patient, uh, implications might occur because of this process. There is also an increased rate of readmission rate if a discharge process is not done adequately to the way that a patient has understood what was needed of them as they transit from the acute care facility back home. This project took place in a facility that uses the conventional discharge model, where a wall full of information is given to the patient when they are discharged in the last day. This has become a concern, and this has become a passion for me to create ways and see how can we do this. And early discharge practice will, be a very effective way to correct this process. Specific aim. Like I've mentioned, the aim is to improve patient discharge process in the hospital. Also, to improve patient satisfaction through better outcomes. It reduces complications. It reduces readmissions. Complication in such a way, for example, patients when they are, discharged back home, for example, with a JP drain, if we don't teach them how to adequately empty the JP drain or to look for sign of infection and be able to identify that, that becomes a complication if they transit back home. All this information we can tell them in the last day they go, but they might not be able to return all this information. But when this information are given to this patient in a timely manner, in a little bit by bit, on a daily basis, they tend to understand the information, they tend to ask questions even before they leave the hospital. Review of the literature. I looked at a couple of review of the literature to support this new change of practice. And in three categories of ways this has effectively supported this topic. Effectiveness of integrated discharge teaching. Study was done by Stevens and his colleague, which shows that it improved patient satisfaction with care. There is also less likeliness to be readmitted into the hospital when a proper or an early discharge process was done before the patient left the hospital. It lowers the rate of complications. These are questions or needs that need to be addressed before the patient leaves the acute care facility. When we do it in a timely manner, it tends to reduce that rate of complications because the patients are well educated and they will be able to take care of their needs even as they transit back home. Impact of health literacy. Understanding a patient's ability to understand the information we're giving them before they left the hospital is essential. And we can only do that in a very universal way by making sure that we assess this patient in a well standard format. Patient centered discharge teaching is essential as well. Every patient is different. Patients, they come to the hospital with a different diagnosis. We don't give them the same kind of information as they go home. So the need to put the patient in a well-centered manner as we provide this discharge information is essential. We can effectively prepare patients to transit back home with our teaching method by the use of written materials, verbal, video, and also to provide discharge teaching in such a way that the patients will be able to take part in the process. When we allow a teach back process method, it's very effective with patients that are going home with equipments. For example, a JP drip, a Foley catheter, or a humovac that will be going home with a patient. We will allow patients the opportunity to return demonstration how to empty those catheters, how to empty the humovac, how to compress the humovac and close it back so that it will create that negative pressure to be able to pull the blood from the infection site. And if we do this in a very timely manner, it is essential because it will help these patients be very comfortable doing this even as they transit back home. Using video conferences to provide this such teaching is also effective. Is also very effective based on the literature review. Sometimes family members might not be able to be in the hospital before a discharge is implemented. We can utilize video conferences and talk to family back home, and also even do a teaching through the video. That way they will be able to see it. Learning will be effective for both the patient and the caregiver if they are being taught together as well. Comparing the outcome of early discharge versus late discharge. When an early discharge is effected as soon as the patient gets into the unit, there is more likeliness to increase satisfaction, and also the care and also the successful transition as they go back home is highly positive. But when a late discharge is done, information is rushed, and then the patient is less likely to recall all those information when they transit back home. Theoretical framework. I chose the Lewis model of change to support this project. Change is essential. The aim of this study is, like I've mentioned, to change the way we implement discharge process in the hospital. Implementing an early discharge process will help the patient and their family transit successfully back home. This model has 3 stages. Using the ice cube explains in detail what the stages are. The overall involves planning, communication, and consistencies. At the initial stage, we see the need for change. Like on this project, there is a need for change on the way we provide discharge in the hospital. And that will make us implement teaching process early teaching process that will create change in the lives of the patients, even as they stay and also transit from acute care facility or acute care units back home. Change comes with resistance. At the second stage, there might be resistance from patients or family concerning the new change. But if we continue to provide teaching in a consistent way, it will overcome those resistance. The final stage is the refreeze stage, which is when change has taken place. And if we've done a good job teaching and reinforcing on those two stages, it creates changes that would last longer, which is the last stage, the freezing stage, which is a successful implementation of the change. This study used the quantitative explorative study where a retrospective chart review of the HCAP score was used to measure the satisfaction rate pre and post implementation of the study. The study comprises of a total of 100 participants, in which both male and female were included in the study. An open-ended questionnaire was used to ask questions to these patients in such a way that we can understand their level of satisfaction and also to implement ways that will bring improvement. The HCAP score stands for the Hospital Consumers Assessment of Healthcare Providers and System as well. That is the full meaning of the HCAP score. Data collection. During this research process, the HCAP score from patients age 18 and above to 89 of age were included in the study. And there's also documentation of patients being admitted between April to November of 2021. Participated integrated discharge plan was implemented to be able to understand the differences between the two groups that we were trying to compare if there is a satisfaction. And it has completed the HCAP score survey also as well. So once patients are admitted into hospital, after they discharge back home, a survey was sent back to them, and they will complete that survey, and that survey returns back to the hospital. And that is how we get access to those information and see what the patients are saying in terms of discharge information. And the HCAP score help us to pull out questions from 6, 15, 16, 17, 20, and 22, which comprises ways that will measure patient satisfaction based on discharge process while they were there in the hospital. A set of pre-discharge checklists was created in 4 subtopics. That way, the questions that we have help us to measure the satisfaction rate of this patient. For example, the first part comprises of my plan of care, which is the patient's plan of care. And questions on that section includes, I have been involved as much as possible with my plan of care in the hospital. This is what we're asking the patient. Are they involved as much as possible? They will tell us yes or no. That way, if they say no, we'll say we will now make ways to make sure that they felt they have been included. I understand what my plan of care is after leaving the hospital. Some people, you might be very surprised, they don't know what to expect when they leave the hospital setting. That will make time for us to reinforce teaching and explain things to patients in detail. My healthcare provider including my nurses, have answered all my questions about my plan of care in the hospital and after leaving the hospital. I am able to also log into my chat. So all these questions tends to, trigger any setback that the patient might be facing while they're in the hospital, even before they left the hospital. That will give us the opportunity to address those questions for the patient. One key is my chat. My chat comprises of all treatment that the patient have received. That way, many patients really don't know how to look or log into that. It gives us the opportunity to help them. We have pamphlets that gave to patients on the process on how to log into my chat. And if they needed our assistance, we went ahead and helped them log in so they can have access to this. Second part of this question includes my self-care management. I understand what to do to prevent my healthcare problems from becoming worse, including how to take care of any equipment, like I've mentioned, JP and foliage, and all those things. It helps us to reinforce teaching and to make sure that the patient is very comfortable before they left the hospital. I understand what my symptoms are and what to watch out when I leave the hospital. This gives us a general idea of their level of understanding about their diagnosis, what to expect, and even if they understood why they were there in the hospital. One big aspect of it is my medication. We try to work and see if they understood their medication, their side effects, if they understood the new medications that have been prescribed to them, how to take it, how to pick those medications from the pharmacy. And then the last aspect of this pre-discharge checklist is the follow-up appointments. Leaving the hospital, do they have arrangement? Do they have a convenient arrangement leaving the hospital? Do they know how to follow with the doctors or the surgeon after they left the hospital? Also, is there a need to arrange for a transportation for a follow-up for the patients? Many patients will be surprised they don't have those things available to them. This is when we involve the case management into it and see ways that will help these patients transit smoothly back home and do their follow-up appointment, pick their medication, watch out for signs and symptoms, take care of their equipment while they are not at the acute care facility. I have contact information for my healthcare. This is how to know how to contact the doctor as they discharge back home from the hospital. So the nurses were trained in this unit to be able to implement this teaching. We did an in-service with the nurses, and nurses were able to implement this teaching. But day shift and night nurses were involved. Those set of questions that we went through, for example, the day shift nurse will go through 2 bullet points. The night shift will continue from where they stop. They will initial each point they discuss with the patient. That way we try to cover all those points before the patient left the hospital. That way we will be able to make sure that they are ready to go back home. The HCAT score from the patient's age 18 years to 85 of age were included, and then also patient admitted with an intellectual disability like dementia were excluded from the study. Patients that are less than 18 years or above 90 were also excluded from this study. And the last part is patients that are transferred to a facility or a rehab are also excluded from the study because they automatically don't get the survey for them to fill it up and send it back to the hospital. Data analysis. So I use the chi-square analysis or the chi-square to be able to analyze the data to compare between these two groups. Like I mentioned before, it was a descriptive statistic analysis where we measure those data gathered from pre and post assessment. A total of 100 participants, 47 were male and 63 were females. Ethnic distribution includes African Americans, which are 23%, Hispanic 30%, the Asians are 28%, and Native Americans 19%. The results using the Mans-Whitney test shows a significant improvement with a 0.05 level confirm the patient satisfaction level. The bar chart and the pie chart shows those distributions with a 65% in satisfaction rate and 35% unsatisfaction rate based on the analysis done on this study. Discussion. So, this study show a correlation with the level of satisfaction among patients admitted to the hospital pre and post teaching on early discharge process. The statistical significance between the patient satisfaction level after executing the discharge process also were seen in this study as well. The major limitation includes inadequate time frame to train and also validate teaching effectiveness of the nurses before this study was implemented. And there's also resistance to change. In every organization, new change, a new way of practice come with the resistance to some of the staff. So we've seen a lot of resistance among staff as well with this new project. Implication for nursing, for the nursing. This study implies that the discharge protocol should commence immediately that a patient is being admitted into the facility. Also, clear communication between the patient and the healthcare, including the nurses, is essential because it helps the patient to be able to clear any doubtful information they don't understand. Researchers, so implication for future research, there's the need for this to effectively continue and for researchers to maximize the information gathered so far in the study. It's also it's good for a long-term effort on implementing an integrated discharge protocol in the hospital setting. Implementing the project helps patients to have a better understanding, and also it decreases complications. It promotes effective communication between the healthcare workers and the patients as well. In conclusion, this was a retrospective chart review of the HCAP score with the aim of implementing early discharge process to change practice and to improve patient readiness and satisfaction rate, to improve satisfaction score on the HCAP, and also a longer time frame study in the future is required for this topic. Any questions? I will take the time to answer them. And I want to thank every one of you for listening and for being part of this project. These are my references. God bless you all. Thank you.